some women, of course, are going to need a lumpectomy or a mastectomy. What is the process of deciding which direction surgically is needed?
So if a patient needs a mastectomy and they are not a candidate for a lumpectomy, be it because the area is too extensive or they have multiple areas of cancer, I'm very upfront about that. And I think it's also important to let them know you have options when it comes to breast reconstruction and still waking up with something that appears to be a breast, something that you can be happy with. There are so many health disparities, surgical disparities, and certainly breast cancer disparities. But did you even know like Black women and Asian women are less likely to be offered breast reconstruction even when they need a mastectomy? And so that's something that's very important. And I ask every single patient. For the patients that want lumpectomy, I make sure they're very clear about what treatment and what breast conservation looks like afterwards, because most patients will need radiation afterwards. And I want to know, are you okay with that? Because some people don't want radiation. And if they say they don't, then maybe we need to look at other options for you. Surgery, I try to make it a team sport. I let patients know, especially if they're a candidate for either, that this is not a decision you have to make today. Call me in a couple of days if you need to think about it, because some people do want to discuss with their families. And I also let them know that what you decide today, you may change your mind a year from now. So there are options. Reconstruction is covered by insurance. And so that's not something the patient needs to worry about. And I try to make that very clear.
And so why do you think there's a disparity in sharing that particular option for women of color?
What a loaded question. I don't know. Where are there disparities in general? Like there's this system, right, that's been set up from jump where some people deserve things and other people don't. Why are we less likely to be offered screening mammograms? Why are we less likely to be offered screening mammograms that are read by an actual radiologist? Why are we less likely to get our results in a timely manner? Why are we less likely to be offered the right kind of surgery? Why? It's exhausting. Why are we less likely to be offered radiation? Why are we less likely to be offered the right chemotherapy regimens? And so like,
it's just there. It's there. Yeah.
It's this never-ending sea of why, even though you have all these trained people who are freaking Cape Crusaders. And so at the end of the day, I don't know why.
Yeah.
I don't know why. I just know that I'm very focused on being a part of the solution and making sure that I do everything in my power to ensure that every single patient is treated the way they're supposed to be treated.
And so when we talk about mammograms and Black women and our statistics of being diagnosed more aggressive, dying more, what do you think in terms of the guidelines? I mean, for Sisters Network, we believe that the guidelines should be reduced to 35 to help capture more diagnosis for women, particularly Black women. Right now, of course, it's 40, but given the statistics and we're getting it younger, obviously some sort of change needs to be made because what we have now is not working.
Absolutely. And what a Herculean task to even get the United States Preventative Services Task Force to even say that women should start mammograms at 40 and hopefully get them done every year instead of every other year and starting at 50. And Sisters Network, y'all are already on it because American College of Radiology and Society of Breast Imaging stated years ago, I want to say 2018, and then they put out another statement in 2020 or 2022 stating that Black women and women of color should actually start their mammograms at 35. And then a lot of people don't even know this, and It's on their websites, but start at 35 because we are more likely to be diagnosed with cancer before the age of 40 and also have a new cancer on our first mammogram.
Wow.